Greeting from Delhi Medical Council, and this lecture is going bit offbeat. It's not about medical science as such, but I promise next 30 minutes will change the way you think about your practice and your life. This is the Delhi Medical Council. We have totally reorganized it. Now, let us come to business right now. This is my 9th year as a president of Delhi Medical Council, and one of the job of Delhi Medical Council is to oversee the litigations against doctors and hospitals. And when I joined 9 years back, we were getting 15 to 20 cases in a month against doctors, but today I'm getting 70 to 80 cases a month against doctors. You see, within this span of 9 years, number of cases has spiraled down so much. But more worrisome is that apart from number of cases, the second line, the litigants are much better prepared now. Now, whenever a patient files a complaint against a doctor, he reads about the laws, he reads the medical ethics, and he has a lawyer behind him, and most probably some doctors backing him. So they are much better prepared than us. Ethical violations and misconducts are more common. You read a lot of orthopedics, but you never read medical code of ethics. इस हॉल में जितने लोग बैठे हैं कितनों ने MCA कोड ऑफ एथिक्स पढ़ा हुआ है? There is something called MCA code of ethics, you know? MCA code of ethics govern our each day practice. कि आपको प्रिस्क्रिप्शन कैसे बनाना है, चार्जेस कैसे लिखने हैं, डिग्री कैसे डिस्प्ले करनी है. You don't read them, but when patient files a complaint against you, he reads all those, and he'll find some violation ethical somewhere. And if there is a violation ethics, you are lost. Your case is lost. Even your patient is all right. So please go home and read it. Huge financial compensations are awarded against doctors. अब ना lakhs में बात नहीं होती, कई करोड़, 2 करोड़, 4 करोड़ में दे रहे हैं काफी. You must have heard the case of AMRI Hospital, Kolkata, 11.4 crores against a doctor. Orthopaedics में तो सबसे ज़्यादा cases आ रहे हैं. Please make sure you are very. And since we have no well-defined laws, personal discretions matter a lot. So here are the options before a patient to file complaint against doctor. He can go to a state medical council, he can go to consumer court, he can go to civil court, he can go to NHRC, he can go to police, and he can go to all 5 places together. And you have to defend your case in all the 5 places together. Whether you like or dislike it, this is the law of the land. Please remember this. And how we in Delhi Medical Council address the cases when they come to us. Whenever we get a complaint, we send this complaint to concerned doctor or hospital, and we get their written reply along with the supported documents. Now the first stage is called executive committee. As a president, I chair that committee. We have 5 members, and apart from 5 members, we opt an expert in that particular subject, and we all sit together with the complaint as well as the written reply of the doctor or hospital. Now if you find something, there is no prima facie which need to be further probed, we dismiss case right there. But if we find something which needs further probe, it is referred to our second committee, is called disciplinary committee. Now this disciplinary committee calls doctors several times, he calls patient complaints several times, and apart from expert, this committee has 3 non-medico members as well. So this is a large body where you are grilled a lot of time, and finally whatever the decision of disciplinary committee or executive, it goes to the council. Now this council has the power of accepting, rejecting or modifying decisions of the executive committee. That is the 3-phase step where how we decide the cases of medical negligence. But most important is the executive committee. I'm just coming back again because executive committee decides a case just based on documents. We don't call doctors. So if your documents are well, your documents are proper, it's very likely 80% cases your case will be dismissed and you will not be called for harassment in disciplinary committee. So that's the importance of documentation. Now if we understand how we adjudicate cases, there could be 2 aspects. As a jury, how I judge those cases when they come to me, and that could be your aspect as well. So there are certain laws in our country. Unfortunately, we don't have any defined medical laws, but there are certain laws which are applicable to us as well. So law of a tort is some civil wrong. Relevant section of IPC and CRPC which have been replaced by BNS. So you must go through them. Various acts applicable to your hospitals like MTP Act, PCP India Act, POXO Act. You should be aware of them. Consumer Protection Act, we are all covered, even if you are in government hospital, even if you're a single patient is charged for a single service in a year, all the patients covered. So it's not that if some of patients are paid, some of patients are free. Even free patient can charge you under CPA. And MCI Code of Ethics, I just told you, please go and read it. It's very important. It's very small tips are there. Clinical Establishment Act is the original form is very draconian, very anti-doctors. Unfortunately, it has been it is applied in so many states of India. But Delhi may still, we are, because I am one of the advisors to the CM. So in Delhi, we are not applying Consumer Protection Act as such. We are trying to make a Delhi health bill, which is more, you can say, fair or friendly to doctors. So how we actually educate those cases, because since there's no fixed medical laws, so most of the judgments what we do or maybe various courts do, they are based on the conventions, reference cases, or the most important, the common sense. So traditionally, a medical negligence has 4 components. First, there has to be duty to care to your patient. There has to be breach of duty, either by some act of commission or omission. That is, the breach of duty has to be there. There has to be damage to the patient. Without damage, there is no negligence. And there has to be a direct relation between that damage to and that act of breach of duty. So these 4 elements are important. You need to understand those, because if you can prove even a single element is missing, the case against you will be dismissed. So just to go through them, duty to care, you have a professional privilege. You have a right to refuse a patient if you want to, unless the patient has an emergency. Or in case you are employed by some of the hospital, the contract is between that owner and the patient, so you cannot refuse there because you are being paid by the owner. Now, what is the breach of duty? I just said it's something which you did, you were not supposed to do, or you failed to do which you were supposed to do, so it's called breach of duty. But how we actually assess it, there were 2 components we look into to assess whether there is a breach of duty. First, a reasonable degree of skill and knowledge, and a reasonable degree of care. And what is a reasonable degree of skill and knowledge? It is about your degree. Please do not flaunt a degree which is not recognized by National Medical Commission. Please. At times you have a tendency to write, if you are writing joint replacement surgeon or orthopedic, whatever, please have a backed up degree which you can claim. And please do not claim to be specialized unless you have a backed up degree. Doctors of doctor are losing the cases just because of this. A MD medicine doctor wrote cardiologist. Somebody came to him with a MI. Treatment was all right. Patient recovered, but still files a case because I was under impression he's a cardiologist. He was not cardiologist. Doctor lost the case. So please do not claim a specialized unless you have a degree recognized with. We are getting lots of cases in medical council. And the other question is how to assess a reasonable degree of care, because degree of care can be so different in different places. So what we do, we imagine a doctor in a, if you can say, moderate circumstances. Like we don't expect highest degree of care, but we won't settle down with the lowest degree of care. So under that circumstance, we imagine a reasonable doctor. How would he perform for that patient, and add as compared to that doctor, how did you perform? If you are reasonably around him, it's okay. But if your standard of care was much lower than that expected standard, then it can be labeled as medical negligence. So there are traditionally 3 international highlighted cases which determine how we proceed. One is the Bolam test. Many of you must have heard it. Mr. Bolam was a patient of schizophrenia. It was a case of 1953 somewhere in UK. And even that time, one of the mode of therapy of schizophrenia was electroconvulsive therapy. Now this gentleman was given ECT, and during ECT he developed acetabular fracture because of convulsion. Now this gentleman files a case against doctor, says I should have been given a muscle relaxant before that. By doing that, the fracture could have been prevented. Now this was the first time judge had such case of medical negligence against doctor. He didn't know what to do. So what he did, he constituted a committee of few doctors, and he posed same question to them. Now some of doctors said that muscle relaxation should have been given. Others said it could have been done without muscle relaxants because muscle relaxants have their own complications. So what he came to judgment, this gentleman, and this is known as Bolam test now. In a situation, if you have two options, A or B, it is your therapeutic privilege to choose either of these two as long as both are acceptable by your fraternity. Any court cannot question you why I chose A or B. So this is the Bolam test. As long as both are acceptable, you have, because you might have a situation where you want surgery or not surgery or X surgery or B surgery, it's your privilege, but those options should be acceptable. Now second came the Patrick Berlitho case. Patrick was a small child suffering from a repeated croup and admitted in hospital. Now child was admitted on the first floor and the two doctors were sitting in the OPD downstairs. Now, during one of the bout of the croup, the child develops apnea. Now the nurse on the duty calls the doctor. By the time doctors reach upstairs, the child recovers. So they just did nothing and just gave some oxygen, they went down again. Unfortunately, after half an hour, same incident repeats. Now again she calls the doctor, and again by the time doctor reaches up, the baby was all right. Unfortunately, the same thing happened 1 hour later also. By this time, by the time doctor reached upstairs, baby was already dead. Now this, the mother of child files a case against doctor. She said, some of my friend told me if my child would have been intubated on the first incidence, my child would have survived. So again the question came with the judges. They constituted a committee. Now some doctors said कि like intubate करना चाहिए था, कुछ ने intubate नहीं करते चल जाता. अब strictly ने Bolam test non guilty था, but just said no, something is wrong there. I won't go by that. Then came the second concept. If you choose option A or B, you must have an explanation for that also. Need to have an explanation. So that is bit higher than the Bolam. In our council, we always ask, sir, आपने A or B choose किया, तो आपने क्यों choose किया? तो need to have an explanation. And thirdly, this is a very recent case, 2015, Miss Montgomery. Miss Montgomery was full-term pregnant lady. She goes to an obstetrician for delivery, and she was offered a normal delivery. During delivery, baby develops asphyxia. Now this lady files a case against doctor saying, I should have been offered cesarean section because I am short-statured. Now the again question came with the jury, cesarean करना था, normal delivery करनी थी. Some said कि cesarean करना चाहिए, तो सबने कहा normal भी offer कर सकते थे. As per Bolam test, both are non-guilty. But the here question is like, who will decide option A or B? So came the concept of the informed consent here. Now we have option A or B or C. You please tell your patient option A ये treatment है, option B treatment है. Now let the patient decide what he wants. So that is the concept of informed consent. So how it develops? You decide, but you must have an explanation and let the finally patient be informed, and patient should give a proper consent for whatever option you are choosing. So that's how these medical legal issues are developed. Criminality, I'll just skip. The only thing is that 304A was applicable to us and was said that doctors will be put out of gambit of criminal cases, but it's not so. Now it is has been replaced by BNS 31061, and in fact it is much worse than 304A for reasons, because 304A was a general kind of law. It involves anyone causing a death due to rash or negligent act, not mentioning medical profession. So mostly judge would be very lenient about doctors. But in 31061 specifically mentions medical profession. So that we are now totally under the ambit of criminal negligence. And secondly, 304A said a doctor can be given imprisonment or fine. But now 106, the recent law, imprisonment has been made compulsory. It's and right. Okay, it's much worse then. And there were two guidelines, Jacob Matthews, in which he said if there is a case of medical negligence, the negligence has to be gross. And secondly, before filing a case against a doctor, a police would seek a medical opinion. And these two judgments were in a vis 304A. Now since 304A has gone, has been replaced by 106, we don't know what will happen to. Please be wary about these facts. So that was the jurist perspective. I'm just bit hurrying. Now, as a doctor, what you can do? That was how we proceed with cases. That as a doctor, what precautions you can take. So please make sure, please take every patient as a potential litigant. We have seen our cases where even the wife filing case against her husband, or any relative filing case against the relatives, or old patient, old friends, old relations, they're filed. Please, every patient is a potential litigant. Please do your job professionally. Please be informed. Please go ahead home and read MCA Code of Ethics. You must know all the relevant acts and judgments. Indemnity insurance is very important. In all the civil cases, if you are the orthopedic surgeon and you are operating the high-end patients, I think 2 crore is the minimum amount of insurance you should have. Because the amount of insurance compensation you will be allowed, you will be asked to pay is not depending upon your degree of negligence. It will depend on the financial capacity of victim. If you are working in a big corporate hospitals, most of the patient is financially very well to do. If a patient is 35 years old, if something goes wrong, then they will calculate if he would survive 70 years, he would earn so much, add to 30%, add to inflation, it will come simply in crores. So please have a good indemnity insurance. MCA Code of Ethics says about your registration, please have a valid registration in whatever state you are practicing. It is not allowed to practice without a valid registration. Suffix, please put your degree, only those who are recognized by National Medical Commission. Display degree charges, advertisement, certificate, please do not give fake medical certificate. There are certain guidelines of medical certificates. It is on our website, go and read it. Because orthopedics में बड़ा लंबा स्टे होता है, लंबे सर्टिफिकेट्स होते हैं, बिल्कुल फेक मत दीजिए. Every year I cancel license of 3 or 4 doctors because of fake certificates only. That is one of the biggest issues for me, where we cancel the registered doctors. Fake certificate कब मत दीजिए, फंस जाते हैं. Communication is very important. If you have a sympathetic communication with the patient, take my words, 90% litigation will not happen. In Delhi Medical Council, we don't give financial compensation. Patient हमारे पास आते हैं, कंप्लेंट करते हैं, 2-2 साल टाइम भी खराब करते हैं. Mostly because they are very angry, and they are very angry with the attitude of doctors. सर कि इतना ढंग से बात नहीं करते थे, तो बड़े बदतमीजी से बात करते थे, बड़े एपैथेटिक थे. They are not bothered about treatment, they are bothered about behavior. तो अगर आप ढंग से बिहेव करेंगे, अच्छे से बात करेंगे, 90% केसेस में होगा ही नहीं केस, अगर आपका बिहेवियर ठीक होगा तो. Documentation is the most important thing. It can be your best friend or worst enemy. 98% cases you are winning or losing just because of documents. And the good thing is, a patient has to file a case against you based on your documents only. He doesn't have any evidence. He has to prove a case against you based on all your documents. अगर उसके बाद भी केस हार जाओगे तो क्या कर सकते हैं? अब ये मेरे बहुत क्लोज फ्रेंड का पोस्ट ऑपरेटिव नोट्स हैं सर, आफ्टर मेजर सर्जरी. अब ऐसे केस आएंगे तो आप कैसे बचाएगा कोई भी? आई हैव सीन इन काउंसिल केसेस वेरी सीनियर सर्जन, ही वाज इन डिसिप्लिनरी कमेटी, आई कुड नॉट रीड हिज हैंड राइटिंग. सर मैंने कहा सर मैं पढ़ नहीं पा रहा, पढ़ के बता दो. इवन ही कुड नॉट रीड हिज ओन हैंड राइटिंग. अब उसमें 3 नॉन मेडिकल मेंबर बैठे हैं, तो ही वाज सच ए सॉरी फिगर फॉर अस. उसने कहा सर ये तो खुदा है, इनको क्या पता. पेशेंट बोला क्या लिखना क्या, तो प्लीज कम से कम ऐसे लेजिबल हैंड राइटिंग तो हो. तो कुछ चीज़ें हैं नोट्स में, डेट, टाइम, साइन, नेम लेजिबल होना चाहिए. इफ यू हैव ओवर राइटिंग, कटिंग इट, प्लीज मेक श्योर द पोर्शन यू आर कट हैज शुड बी विजिबल है देयर. ऑपरेटिव नोट चलिए. पोस्ट ऑप में मैक्सिमम प्रॉब्लम्स होती हैं. वो सर्जरी के ही चले गए, पोस्ट ऑप में कोई देखता नहीं, ब्लीड कर गया पेशेंट, कुछ कर गया. पोस्ट ऑप में जो ध्यान रखिएगा. और प्लीज फर्ज मत करिएगा नोट्स. कई बार नर्सेस के नोट्स क्रॉस चेक करते हैं, आप लोग फंस जाते हैं. Discharge advice is very important. Unless patient is all right, your duty to care doesn't stop here. And the important thing is whom to contact in emergency. 3 or 4 cases where patient rang up a doctor 2 a.m. in the night and doctor didn't pick up the phone. He filed a case against doctors and doctor lost the case. Simply because the discharge paper, it was not mentioned whom to contact, where to go in time of emergency. अपने प्रिस्क्रिप्शन पैड के नीचे छपवा लीजिए कि इमरजेंसी में प्लीज इस हॉस्पिटल पहुंच जाए. ना नंबर मत देना कभी भी, क्योंकि नंबर तो उठाएगा नहीं कोई. इन इमरजेंसी प्लीज रीच कैजुअलिटी मैक्स हॉस्पिटल. आपका काम खत्म. बट फिर डोंट राइट एनीथिंग, पेशेंट ट्रैप्ड इन इमरजेंसी और यू आप फंस जाओगे. Negativity, please you always mention. Negativity बहुत इंपॉर्टेंट है, बाद में लोग डिनाई कर जाते हैं. आपने सीटी स्कैन का, एमआरआई का टेस्ट किया, उसने नहीं किया, आप लिख दीजिए नॉट डन, कोई बात नहीं. वट एवर यू डू, वट एवर रिटर्न विल एक्सेप्ट. नहीं करोगे कोई बात नहीं, लिखा होगा मान लेंगे, नहीं लिखा होगा बिल्कुल नहीं मानेंगे. Now consent is very important, especially it's a legal requirement. Body is sacrosanct. Without consent, you cannot touch a person's body. Samira Kohli versus Prabha Chandra case, very famous case. Supreme Court की guidelines हैं. Please go home and read in detail क्या कहते हैं. Now consent has to be two portions important. It has to be informed and valid. And what is informed consent? To be informed consent, there has to be 5 elements necessarily. Even if a single element is missing, your consent is an informed consent. And consent is so important, even if your patient is perfectly all right, your treatment is perfectly all right, but if your consent is not right, still the patient can sue you and you will lose the case. That is a legal requirement. This is not medical requirement. So there has to be a necessity. What is the necessity of the procedure? Nature and limitations, consequences, risk and alternative methods. These 5 elements are to be there in every consent. Otherwise, the consent is invalid. Now, the big question is how much information has to be given. That is something not very clear. There could be various way of thinking of it. Britishers think some different, Americans say them different. But basic knowledge should be given. Some major known complication you must tell. India, we are a bit lenient about it. Now these 5 areas where I find mostly your lacking in consent. Consent में इन 5 एरिया में सबसे ज़्यादा गलती होती है जो हम लोग काउंसिल में पकड़ते हैं. तो फर्स्ट और फॉरमोस्ट कंसेंट हैज टू बी प्रोसीजर स्पेसिफिक. अगर हिस्टेक्टोमी का कंसेंट है तो आप ओवरी को टच नहीं कर सकते. प्लीज आपके जो भी प्रोसेस होते हैं, अगर आप ओपन लेप्रोस्कोपिक करते हैं और आप उसको ओपन करके नहीं, अगर कंसेंट इज फॉर लेप्रोस्कोपिक यू कैन नॉट ओपन इट. If you foresee a possibility of opening it, please take a consent beforehand. Otherwise, please do not exceed the scope of consent. It is illegal. Second, consent has to be person specific. The person, the surgeon against whom the consent is taken, he has to operate only. At least he should be in the OT only. There was a case, orthopedic case था दिल्ली की corporate hospital का. The person was being operated and the operating surgeon was sitting in the OPD, against whom the consent was taken. The doctor lost the case. So OT के अंदर consent has to be person specific as well. There is no role of proxy consent. The patient is adult, sound mind, patient himself or herself will consent. किसी ब्रदर का, मदर का या हस्बैंड ने वाइफ का कंसेंट की कोई वैल्यू नहीं है. These are legal requirements. You will lose the cases. In emergencies, obviously you can go ahead without consent, but you need to explain what was the emergency in case the case is filed in the court. And please do document negative consent. If patient refuses anything, अपनी हैंडराइटिंग में लिख दीजिए, बेटर उसके साइन करा लीजिए. अगर वो साइन नहीं करता आप लिख दो, हम मान लेंगे, बट इट हैज़ टू बी डॉक्यूमेंटेड. नेगेटिव कंसेंट बहुत इंपॉर्टेंट है. बाद में पेशेंट कहता है सर हमें तो बताया नहीं गया था, हमें तो करने के लिए कहा ही नहीं गया था. दे विल ऑलवेज से लाइक दिस. सर जनरल प्रिकॉशंस हैं. ऑलवेज टेक एडवाइस, रेफर अर्ली, नॉलेज अपडेट करिए. जितनी आप CMA से ट्रीट करते हैं इसके सर्टिफिकेट रखा करिए. इनकी कोर्ट में बड़ी वैल्यूज है. मेडिको लीगल केसेस में भी रिकॉर्ड प्रिजर्व करना है. These 2 things are important. If you are working in a small nursing or small setup, please make sure all the facilities are available, because hospital owner is not liable. You are liable as a consultant who is admitting the patient there. And if the staff is not qualified in that particular that setup, even then you are liable. That is the law. अगर आप किसी सेटअप में एडमिट कर रहे हैं, अगर वहाँ का RMO BAMS है, BHMS है, क्वालिफाइड नहीं, और something goes wrong, not the owner admitting consultant is responsible. That is the law. ये बहुत केसेस आते हैं हमारे पास इस तरह के दिल्ली में. Please be updated. DMC वेबसाइट में जाइए. DMC वेबसाइट में we put all the cases which have come to us. We have almost 5,000 cases so far. Every case is there. You can go there and they are given full details, including what is the outcome. I write very regularly on DMA bulletins of various specialties. We can go through that. In case a case is filed against you, please do not panic. Please attend all the cases personally. Please never leave on this kind of lawyers which they hardly have an idea about medical science. Take due cognizance and reply in time. And day one, please inform your insurance company by mail, not by WhatsApp or telephone, because day one will involve them. Otherwise, whatever financial compensation is to be given, that company will give you finally. Please consult a medico-legal expert before filing your reply, because your first reply is important, and this reply will go till the Supreme Court. The first reply is very important. Do not give unnecessary details, just stick to your points. And never tamper with notes. Tampering of notes is a forgery, it is a criminal offense. Please put affidavits of colleagues and give reference of standard textbook. In the sequence, first Indian textbooks, second preference is Western textbook, third is Indian journal, and fourth is a Western journal. That is the sequence which give you importance. And law is mostly black and white if it is written, but if it is not written, if it is grey, what matters is grey matter. That is common sense. So this phrase I have coined. In case you are able to explain to us in our council under what circumstance you did the same thing, so we'll leave you. You should be able to explain, because most of things are grey. And intent does matter. If you do something with right intent, Delhi Medical Council is with you, will go to full extent to protect you. But if your intent is wrong, you give certificate for in lieu of money, you do something unethical, बड़े तरह के केस आते, you won't believe लोग कैसे कैसे केस करते हैं. In one case, gastro surgeon, like he did some other surgery, but discharge paper were written some other surgery. I asked, क्या हुआ सर? कि वो ना इंश्योरेंस में पैसे ज़्यादा मिलते थे उससे. अब जहाँ इंटेंटली गलत करेंगे तो वहाँ कोई छोड़ेगा नहीं आपको. तो प्लीज़ इंटेंट ठीक रखें. Delhi Medical Council is with you, and as a council we are simply watchdogs. We are not bloodhounds. We are not after you, but you are just here to. In a Delhi Medical Council, I started this campaign I go to each conferences and teach them medical law. My every Saturday, Sunday goes in this. It's my mission to every doctor must know there's something like called medical law. He should be aware of this. Just to conclude, with proper precautions, 90% litigation can be avoided with good communication and documentation. Be prepared. Every patient is potential litigant. Be prudent. Average skill is required, not below average. Never forget consent. Communicate everything you do or write, and document what you communicate. Finally, life goes on. Do your best. Thank you very much.